Thank you guys for joining us for our webinar Wednesday on shared decision making, your MS, your voice, your choice. And my name is Tori Carter, and I'm Programs Manager with Can Do MS, and I will be your moderator this evening. I'd like to take a quick moment to thank the sponsors of this program and let you guys know about a couple other programs we have coming up at the later part of this month. We have our shared decision making jumpstart program happening on July 13th. We also have our Your Questions Answered, where you can bring all of the questions that you think of during this webinar to that program and chat with some healthcare providers there as well. And then we will have a coaching series starting on August 9th about reducing your risk of falling. If you guys are hoping to join one of our in-person programs and live in either the Seattle or Dallas area, we would love to meet you in person. We have 2 more opportunities for our 2023 in-person community programs that are on your screen here. We also have virtual options as well if you would like to join us from home. And we will have those options on the website to register for any of those programs that I mentioned. Before we get started with tonight's program, I would like to highlight a couple features of Zoom webinar that you can utilize during the program. So we have the chat box where you can interact with our speakers as well as other participants. And then we have the Q&A box that we would love for you to utilize during this program, because we will have a Q&A feature at the end where we will get to ask our speakers tonight some of those questions that we've thought of throughout the program. And of course, we always have the closed captioning feature that you can use as well. All right, and I'd like to introduce our wonderful speakers we have tonight. So we have Lucy Carrier, a psychologist from Las Vegas, Nevada, and Suma Shah, a neurologist from Durham, North Carolina. And I will turn it over to them to let them introduce themselves and take it away.
Go ahead, Lucy.
Yes, hi. I'm a clinical health psychologist here in Las Vegas, and I have a specialty in multiple sclerosis, and I'm just really excited to be here tonight and be part of this webinar.
Hi, everyone. I'm so glad to be here and be part of tonight's webinar. My name is Suma Shah. I'm one of the MS and neuroimmunology specialists at Duke University School of Medicine here in Durham, North Carolina.
All right. Well, we'd like to start off with our learning objectives and what we hope to convey and discuss tonight as part of our webinar. The first of which is just simply understanding and kind of recognizing the impact that shared decision-making can have in overall MS care. Secondly, we want to learn how shared decision-making can integrate into the provider's expertise, but also to recognizing your goals and preferences for care. And finally, we want to learn, we'd like you to learn how to initiate conversations about shared decision-making with your MS care team providers.
Well, before we get started, let's make sure we're all on the same page. What is shared decision-making? I found this definition from a paper that was recently written on exactly this concept. And as you all can imagine, this concept may apply widely to all fields of medicine, but what it's been defined as is an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences.
So let's talk through the components of shared decision-making. We've heard from Suma the kind of large overarching goals that come about with shared decision-making, but we really want to emphasize the process behind it, that there's several steps that really help support that process between patients and their providers. Shared decision-making may come into a variety of different clinical decisions or situations. It could be that you're facing a decision in which there's more than one option, or maybe the pros and cons aren't quite outweighing one another and you're not quite sure where to go. So this is kind of where we'd want you to think about that shared decision-making in that clinical process. It's part of really patient-centered care. So first off, we want to recognize that you, the patient, needs to make a decision. Maybe you're faced with a change in your MS care. Maybe you're wanting to add something in. You read something really quite interesting that caught your attention and you want to bring it up with your provider. The second part of it is discussing it, actually presenting it to your provider, talking through what that available evidence is with your provider. What do you know about it, as well as transitioning and sharing your preferences. How does this fit you, your lifestyle, and your overall preferences for care? And then finally, it's kind of working with a provider in that collaborative stance of making a decision. How do those pros and cons weigh out? And how do we find the best kind of path forward? All right, so how do we begin this process? As you know, Suma and I have been alluding to, this is really a kind of a patient-centered clinical approach. It's a clinical care model that we really emphasize that should have these elements to it. And so when we start to kind of, again, break it down to some of these more specific steps, we start thinking about how do I set the stage, if you will, to engage in shared decision-making with your provider. Couple things we want to think about. Who's that supportive care partner that potentially you could bring to the visit to help kind of offset some of those questions, provide emotional support for you, maybe help guide the conversation if need be, if that's a fit for you. Sometimes, though, I have patients, and I'm sure, Suma, you do too, where presenting solo might make the most sense. Or maybe you just don't have that person geographically nearby that can go with you. But, you know, thinking through that, just having that right person with you make the difference. Also, too, what's the purpose of the visit? For instance, if you're recently diagnosed and maybe it's a visit in which you are presenting to hear the workup. Maybe your provider is going to go through your imaging. Maybe there's the decision of, does this look like MS or not? You want to know that. Big difference between that and a visit where you're going to do maybe some symptom management. So going in with those clear objectives, if possible, if you do know that, I think helps you then prepare for that. And really leads into that last kind of element to set the stage for the visit of, can you, if possible, do some homework ahead of time? If you are, you know, really got something on your mind, do you have some of those elements kind of written out in a list? Do you have the articles with you? Sometimes I'm always delighted when patients bring those kind of key pieces in to say, hey, I found this. I really want to talk about it. Have you written down your questions? That's probably one of the top pieces of advice I give patients as a psychologist when they're presenting to see their neurology provider. What are your questions? Write them down. We certainly don't expect you to go in and be able to recall that without having some prompts. It's just too much, I think, dynamically to kind of wrangle with. So what are your thoughts, Suma, kind of hearing that set the stage?
I love what you said about bringing in articles. I often tell people one of the reasons I went into MS care and decided to specialize is just how knowledgeable our patients are, not just from the homework they do outside of their time in clinic with me, but rather how interested they are in learning more about the disease. And it's a really special place to be somewhat learning together as we are, but also to have such a engaged group of patients. And I think that the ones who seem to succeed and feel like they're getting the most out of their visits are the ones who come prepared with the questions, and they can say, yes, I went through the things I have been thinking about in the last several months between our visits. It's tough.
Mm-hmm. Absolutely. And I think, you know, to somebody's point in the Q&A that, you know, sometimes managing MS can feel like a full-time job, especially when we think about all the different symptoms that one may experience living with a chronic disease such as MS. And again, kind of going in with, these are the top 3 things I really want us to talk about today. Point 1, I've done my homework on a little bit, and that's maybe where I want to focus. And really kind of talking through that with the provider so that you are on that same page, I think is really important.
I'm also seeing an interesting couple comments in the chat that I'll mention just for that slide. about how the care partner you bring can be different people. And I think the
Yeah.
perspective that your friends versus a spouse or partner versus a family member, who you choose to have in the room with you may have a different set of ears and how they hear what you're also hearing, which is a really important point. Well, how do we ask the right questions, right? Here we are going into a visit and you want to make sure that you get the most out of it. And as I'm seeing in the chat too, it can create immense pressure. You've got this finite amount of time and you have to make decisions on which are the right questions to ask. Well, it shouldn't all be on you, right? But I think it is helpful to go in with an acknowledgement of what you would like to get out of the visit, what matters to you. And if you're having change in disease modifying therapy conversations, how is the medication going to be administered to you? Is it going to be a pill that you may not remember to take every day, or is it going to be an infusion when you're not someone who's enjoyed IV sticks previously? And so acknowledging who you are and where your priorities are and what your values are, and being vocal about it. It's helpful to do that check-in with yourself to be able to advocate for yourself in the best way. And then an example I'll give is I just a few years ago met someone who I found out after the fact worked third shift. And he worked from midnight to 8 a.m. every night, 5 to 6 nights a week. And here I was, 6 months into meeting him. We had started a therapy. He was showing up for it once a month. And I found out at our follow-up visit after starting the infusion, this was about 4 or 5 months into starting, that the timings of the infusions were really throwing a wrench in his sleep cycle. He was leaving work, trying to get a few hours of sleep, and then going to his infusion for a couple hours, and then trying to get a few hours of sleep as well. And so we had a long conversation about whole health and ensuring that he is as healthy as possible, which acknowledges that he needs consistent sleep. And we were able to find a way to contact the infusion center and let them know that he would prefer the first appointment of the day so he could get off his shift and get his treatment. And so it's things like that that we may not always be actively thinking of, but absolutely make an impact. And so those are the considerations that it can be important to share with your care team. What do you think, Lucy?
Mm-hmm. Absolutely. I think it's part of that discussion and something we like to see from the provider side of, as we're talking through this decision, asking the patient, what is it that's important to you? Help me kind of understand how this could affect you, or we've got two options here. I know this about you because, like you said, I've been working with you and I know you work nights. And is this really going to be the best way to, address this particular issue? So, yeah, I think it's having that open conversation that's really important. All right. So now we've set the stage, we've thought through the questions. How do we start the conversation? How do we really have that conversation with your provider? So we've included here some various different suggestions, things to kind of think about with your unique situation with your provider, whether you started working with them last month, or maybe you've been fortunate and you've been working with them for several years. But we really want you to think, could I start with some open-ended questions? I think that's always a great way to start to set the stage with your provider, to kind of start opening up a little bit, hear kind of what the best available evidence is. What do you think? Hopefully you've got trust in their opinion and that rapport is there, but you can kind of start, I think, kind of picking their brain a little bit. Also, too, just in the same light as you're starting to hear from them what that clinical evidence may be, what do you know about it? Hey, doc, I looked through and I found this really good article, or you know what, this came across the news the other day and it really caught my attention. I looked into it. I want to share with you a little bit about what I know. Again, I know time in those visits is tight. So what are those kind of really key pieces that you want the doctor to know that maybe you gleaned from those pieces and sources of information? Conversely, you're going to hear Suma and I say over and over again, be an advocate in terms of voicing what those preferences are for you, in terms of what you value, what matters to you. Maybe you can't swallow medications. Doc, do you have another means for me to, get that medication? Or, you know what, I just can't make it to physical therapy, as you really would like me to. I can't afford my copay right now. Or, it's across town and I just can't make that. Are there other accommodations that we can talk about? So have that, initiate those conversations. Also, too, I think about my own visits with my doctor, and I'm talking through different issues. Sometimes the conversation can go a little fast, right? Especially as we're trying to make the most of those precious moments that we have. One thing we know, right, when we're living with MS, sometimes keeping up with the pace of a conversation may be difficult. It's a lot of information to process all at once. So here's some suggestions of maybe kind of how to stay in the conversation and not feel like it's escaping you. Do we need to ask for it to slow down a little bit? Hey, can you go back? You said one really important piece, and I think that's what I want to hear again. Can you explain it maybe in a different way? Do you have some graphs or some visuals? Those are really helpful for me. And those kind of might be helpful to, again, gear the conversation and ensure that you can walk away with the information that's helpful for you.
It goes back to that first question we asked, right? I think if you can acknowledge or maybe sit and think about your type of absorbing information best. So many of you all said all. And I think the more types of ways that we send and receive information, the more it has a chance to stick, which hopefully sets folks up for success.
One question, Suma, that kind of has come through the Q&A that's helpful is, what about when patients are with you and they're feeling like the visit is just kind of escaping and the minutes are just winding down? Any thoughts on maybe how to, reorient that visit for patients?
Yeah, I think that's where those lists can be very helpful in two ways. The first is some of my very successful visits that addressed many topics were patients of mine that actually sent me those questions ahead of time. And in some of the electronic medical record portals, you can send that and say, hey, not something to answer right now, but I'm thinking of this all and I just want us to have it to reference. And then the second is that kind of visual accountability to say, hey, these were the questions I wanted to ensure I answered, and we just got sidetracked. So how do we ensure that we do that well? So those are the two things I think would be helpful. And then again, using your voice to say, wait a second, there were a few things that I wanted to make sure we got to, and I think we're not there right now. Can we try to address them before we're done?
Yeah, great suggestions. All right, so we know that these are just unfortunately going to sometimes be part of those visits, right? Those barriers. Things may just get in the way as you come in with your very well-prepared list, for example, that you want to go through with the doctor. So we've included here some common barriers that may get in the way. Some of these may be more applicable than others, but we really encourage you to kind of think through, is it more the cognitive piece, the pace at which the visit is going that really gets me off track? Related, is it fatigue? Is it just not having the energy to kind of really engage during the visit? Sometimes kind of that white coat syndrome can get the best of us, and maybe it's just a little nerve-wracking being with a doctor and being on the spot and trying to think through what those questions may be. And related, maybe feeling like you're alone and you don't have a support partner with you to kind of maybe help offset some of that. You may have support partners with you, but sometimes maybe they're a little overactive in the visit and you feel like, you're not really the one driving the visit. Or maybe they're not participating as much as you'd like to see, and you'd really like them to be more active in that visit. One thing that I know has come through the chat is just the amount of information that sometimes can be shared during these clinical visits, particularly if you're trying to think through a new DMT or medication options. It can be overwhelming as you're having to kind of think through in the moment and possibly even make some decisions. As we've mentioned, kind of not being on the same wavelength as it relates to what's the purpose of the visit can be a challenge. Of course, we have to recognize maybe sometimes there's just a mismatch between you and your provider as it relates to maybe just their style or approach. that can make it really challenging to feel comfortable sharing and advocating for some of these things that are really important for you. All right, support partners. I don't know if I have any support partners on with us today, hopefully so, but there's also key ways that you can help facilitate some of this shared decision-making process. And one of the most important ways, I think, is for that communication between you and your loved one, the one living with MS, really thinking through and having those discussions with one another of how do they feel best supported in the visits. I've seen really the continuum in terms of kind of a dyad presentation. Suma, I know you have too, where you've got partners who are finishing each other's sentences or others who are getting the look of, okay, back off, this is my time. I want to be the one to kind of share these things. Or, hey, can you pull out the list? And we're going through and maybe the partner says, oh, don't forget number 3 and 4. We were going to talk about that too. So that to me shows a lot of at least communication between one another. So who's going to take the lead? Who's more in the support? Is it kind of a co-facilitated approach where you're both kind of monitoring it? Who's looking at the time, right? Sometimes we can kind of get into that mode and the doctor's really engaged and answering a lot of questions, but we've now got 7 minutes to go through points 2 and 3 that you really wanted to talk about. So who might be watching the clock? Also, too, thinking in terms of the number of questions that are getting fielded, those can be hard sometimes to keep up with. And then notes, who's taking notes? Maybe there's some really important things that you find really helpful, and maybe support partners, you're kind of making some of those notes. So, Suma, I see a lot of activity in the chat.
Oh my gosh, I know. That's what I've been trying to keep an eye on. And it looks like there's some great discussion about kind of where there can be challenges in finding an MS specialist or a neurologist and how to best advocate for yourself. Is this the theme I'm getting? Well, we can go to the next slide, and I think we touch on that a little bit. So how do we do that, right? How do we adapt to different types of providers? And I think to start, it's a relationship between a person living with MS, their care partners, and the healthcare team that's there ideally to allow them to live as well as they can, as functionally as they can for as long as they can. So getting to know each other is the foundation for that, for knowing what gets your team to show up for what they do during the day and learning their style. How are they most likely to share information? I've got colleagues who will constantly print out a summary at the end of each visit. I've got folks who will have a set of flyers and resources that they'll hand to patients on their way out, or will direct our patients and their loved ones to a member of the healthcare team for additional information and counseling. And so getting to know their sense of how do they approach their role in your care and what their goals are can help everyone sort of set the stage of what are we all showing up for every time.
All right. Now we'd like to present a couple different vignettes to kind of capture some of these challenges and hopefully opportunity for shared decision making to occur between you and your provider. So the first one I'd like to start with is a patient who's been meeting with a provider who says, the doctor's not listening to me. And this can be certainly a challenging one where, again, you may be going in with a certain agenda for the visit that may differ from the providers. Or maybe you've been advocating over time for a certain treatment and you're just simply not feeling as though you're being heard. How do we maybe start to enact some change within that dynamic such that you start to feel heard, such that you can have that discussion regardless of maybe where the outcome may go, but that you've got a platform in which to share some of those concerns and preferences. So again, the first thing we really want to think about is what are the visits, what are the goals of the visit? Is it the providers really wanting to talk through the DMT? They're really noticing that and advocating for a change in your DMT, but you've got some questions about maybe your pain management or maybe some bowel and bladder. That's going to cause some misalignment, right? You're going to maybe potentially feel you're not being heard. So stop in that visit. asking, what is it that we are able and kind of wanting to do today, or what can we do during the visit? Also, too, letting them know again how you learn best. I'd really like if you could share your thoughts. I'd like to share some of mine. Again, do you have some visuals that you can share with me? Some of those printed materials that Suma mentioned can also be really helpful. You've mentioned 2 DMTs that you're thinking about. Can you send home some information on both? I'd like to take those home and read through them. Again, giving you then that opportunity to kind of digest that information. What about support partners? Are you guys having that conversation as you're driving into the visit of kind of what the role is and kind of where you're going to feel that support from them? Are you having it in the waiting room sometimes? That's okay. We want you to have the conversation. Are you letting the doctor know, I'm just not really feeling heard. I really am finding my pain to be most bothersome today. Is there a way that we can have that discussion? Okay, it's not really what you were kind of planning for us to do today. We really need to make some decisions. Could we schedule a follow-up visit? Is there another allied provider in the practice that I could see with, some urgency so we can talk through this? But also too, looking at where maybe some of those barriers are. What can you control? Maybe what's outside of your control with that visit. Maybe there just isn't another provider that I could transition to or transfer my care to. What can I kind of feasibly kind of manage in that moment with that provider? And sometimes that can be hard. What are your thoughts, Suma, on kind of maybe when you've been given that feedback of not feeling heard?
Yeah, this is unfortunately not a story that's all that unfamiliar. I know that was a few double negatives, but it is a story I hear a fair amount. And I think there are challenges in enabling people to find an MS specialist or a neurologist or a care team that they feel heard by when in certain areas it can be pretty resource limited to find someone who's very knowledgeable. And I think that's where the lean towards resources such as this, kind of hearing how other people are receiving their approach to care and advocating for that very frankly with your care team to say, hey, these are my expectations. Are they reasonable? How do you think we can reach them? And allowing yourself to really honestly have a discussion that's open with your care team that's available to you. And then I've had patients who've gone to receive second opinions that are written to ensure that they feel like they're on the right track and bring that back to their care teams locally to say, hey, it seemed like we were at an impasse, but here I've got some direction here. Can you help me implement this to ensure that we're doing what's best for me? So I do think there's some different ways to do it, but there certainly are challenges. And even the example I shared comes with its own privilege of being able to travel or hear from someone else outside of what's accessible to you in medical care.
I liked what you said earlier about finding different ways to possibly connect with your provider that maybe takes a little bit of the pressure off that one-on-one visit that, from some of you I'm seeing in the chat can be as little as 15 minutes, or maybe you have the luxury of a 40 or 45-minute visit. But if there's ways to maybe utilize electronic medical record portals, phone calls maybe with the nursing team to convey some of those concerns, perhaps that, again, takes a little bit of pressure off that precious time.
Absolutely. Well, for our second vignette then today, this is another story that sounded very familiar to me as we were preparing for today's webinar, which is I was just diagnosed. I went and saw a doctor who told me I should be on this once daily pill. And I read about it and it sounds terrible. And I've heard great things about other options out there. What should I do? And I think again that pause to say, hey, this is the information I've gathered from the resources I trust. This is what my healthcare team is telling me to consider, and pausing and saying, there's a mismatch here. Let's talk about it. Is this my only option? Why? Are there things that you've considered that maybe you're not sharing with me? And kind of asking the why behind the recommendation, the medical recommendation, can help. And I think, again, just like Lucy had mentioned earlier, I received more information about this. Can you tell me about it? Or here's an article I read. Can you tell me your thoughts on it? And then it allows more of a two-way discussion to exist rather than only being told that there's one option when in fact there's several, and several that you may have heard of. Lucy, are those things that you've helped folks kind of guide themselves through as far as the discussions that seem like they're one-sided and have a stop sign, but really could lend themselves to other opportunities?
Absolutely. Yeah. And I think again, it's that approach that you take with the provider and thinking about the communication, right? I mean, there's again going to be some of those situations where we as patients may not have as many options, but things that we can change. Maybe driving to a new practice or finding a new doctor just may simply not be realistic or feasible. So how might I kind of make the most of that relationship that I do have with my provider and really kind of say, look, I'm really wanting more information. Um, how may I kind of, hear from you? What are your opinions on this? Give me options 2 and 3. I want to hear it. I think sometimes doctors may be accustomed to patients saying, what do you think, doc? I'll go with what you have to say. And so again, it's always a delight with, patients who want to hear it all, who want to hear what are those options, what's the best evidence, what's the research say, so that you can have that. But you got to tell them, you got to let them know what the preferences are.
I agree. Well, here's some key takeaways just from some of the points that we've discussed already tonight. Um, what I'll share with you all is that having a self check-in first prior to entering a conversation about decision making may allow you to be the best advocate in your care.
Mhm. Absolutely. We also too want you to think about how those in your support team, whether that's your personal kind of support partners or if it's other members of your healthcare team, how they can help support you during some of these challenging situations where maybe shared decision making isn't going as well as it could. Or maybe we're running into some stuck points with your provider. How can you pull in others? Do you have members of maybe a rehabilitation specialist on your team? Is there a social worker? Is there a psychologist? Perhaps that you can turn to with some of those challenges that can maybe help walk you through it or give you some guidance to feel more supported. And of course, those in your personal support team, how can they help advocate and really kind of push that voice forward?
I think part of the reason we have this conversation about shared decision making is that there's not one correct way. MS in particular is a very unique disease with very individual presentations. And what that means is what's right for one person may not be right for another. And I think acknowledging that allows for discussions that are meaningful when it comes to a healthcare provider team and their patient relationships.
And related to that, as Seema kind of kicked off some of our takeaways with, is knowing yourself. What parts of your care do you feel really strongly about that you want to have all of the kind of input on? You want to know all the best available evidence because those are decisions you want to really be engaged with. And what are some of the aspects of care that perhaps you may have more, doc, what do you think's best? I'm going to go with what you have to say. And you see differences with that. And it's letting your doctor know what those areas of care are that are really important to you and reminding them. It's not a one-time conversation, but one in which you'll need to kind of revisit when the situation arises so that you can let them know, hey, this is where I think I want to have a little bit more of a discussion. Let's slow this down. Or let me take these pieces home. I really want to think through this and we'll get back with you at that next visit. And lastly, self-advocacy is a learned skill. It's one in which takes a lot of practice and doesn't necessarily come naturally for a lot of us. And so give yourself some grace as you're trying out some of these new skills and really exerting that voice with your providers.
Thank you, Lucy. That's a great point.
Awesome. Well, thank you guys so much for going over all that information, and you really sparked a lot of questions in the Q&A box. I'm quite excited for how many questions I have in here. So they are going to be a little bit out of order, so just bear with me. But the first one I saw in here that really I thought was very interesting is you were talking about support partners and family and who should be involved. And somebody asked, how old should your children be when you tell them that you have MS, and that this person in particular has 2 teenagers and was diagnosed about 2.5 years ago?
That's a good question. I think that's one both Suma and I can kind of tag team on. I would say with that one, it really kind of depends on the age of the child and your unique family situation. We want to think about the information we do share about diagnosing being really modified to kind of fit the developmental level of the child, and kind of letting them know, what you feel comfortable with, but not inundating them with everything. I think it's kind of as you find there's going to be pieces that are important for you to share about your journey with this disease. And it's having that conversation, but in a way that's geared towards their age and developmental age and maturity.
I think that's the one piece of caution I'd say. I've seen all ages of children in the room with me, and I certainly welcome them as long as the patient who's living with MS is willing to have them there. The only pause point there would be whether that changes the conversation if there are children who may not be mature enough to be privy to some of the conversations that do get sensitive with MS and can sometimes lead to some uncomfortable conversations in the room. But my general approach is asking permission and then having those open conversations. And so if you feel like they're a valuable member to your care team and you would like them there, I think that's step one. And then after that, helping guide the conversation between what's comfortable but also meaningful clinically in that visit.
Awesome. And then there was a lot of chat, a lot of stuff in the chat, and then a few different questions came in. And I think everybody just wants to hear from a healthcare provider, is it okay to record your visits? And is there tips and tricks about going about that?
So I think there's at least 2 layers there. And Lucy, you can tell me if you've heard differently too, but there is the provider level comfort. And then sometimes, depending on where they're employed, there's a different set of rules there too. And I've heard of both sometimes getting in the way of recording. In general, I don't mind recording because I acknowledge, especially living in the world that I do, that having additional information that is referable is helpful. But I have absolutely had colleagues tell me that their center of employment does not allow it as a blanket statement for all recordings. Have you heard other permutations, Lucy? Yeah.
Yeah, I find more often it's the institutional rules that may kind of create the most barriers. So having those conversations, and your provider will be able to quickly let you know what's allowed.
Great. And then we were talking about trusted resources in the beginning and where you get your information. Do you guys have any go-tos or ways to suggest finding information in the right places?
I think first and foremost, the National MS Society is probably one of the best to be able to reference in terms of symptom breakdowns in patient brochures and materials, as well as some of the psychological or social aspects that it can touch on. So that is probably one of my favorites, in addition to Can Do, of course. Also has a lot of great resources with our library. So those are my top 2. Suma, what do you add in?
So certainly, I've seen this on the chat, so I'll have to mention, but I work a day a week at the VA, and the VA in the last decade has really built up its resources. So if you're a veteran in the US living with MS, there is a dedicated set of resources to help provide best quality care for veterans living with MS. The National MS Society has that patient navigator program that certainly for patients who may be more resource limited in areas that don't have great MS comprehensive care centers nearby, they can often help put things together. And then, of course, there's nonprofit organizations such as the MS Association of America that sort of come together and provide local resources to have conversations that can help provide education as well.
Awesome. I was also going to mention the National MS Society to a few people that were in the chat asking about how they can find different MS centers and different support groups. There's definitely search engines on that site for you to be able to find MS providers in your area, as well as support groups. So it's definitely a great resource. Let me find another good one here. Somebody is said that they are a support partner for their mom, and how do they get her to be more involved with her appointments? Usually the support partner does all of the talking and asks all the questions, and she seems to disconnect during the visit and sometimes just basically seeming completely disinterested.
That's one I can maybe speak to first, Suma. I know that can be a really hard situation for support partners where you feel like you don't want to be, overactive in the visit, but there could be a number of factors that could be at play that could be getting in the way as it relates to mood, fatigue, maybe the visit's scheduled at a time that isn't really conducive to their particular energy level or kind of fits their preference for the day. That can get in the way. Maybe there's some of that, concern of maybe saying the wrong thing or getting nervous around some of the providers, or simply maybe that's just kind of their preference. I think what my thought might be is, can you support partner have that conversation before you get to the visit? Maybe figure out what are those really important things. Maybe I'm hearing you serve a really important role, and maybe you keep things really efficient and can convey some of those key pieces. And so that's okay too. I think though that you can have that conversation, then you feel more informed and maybe a little less like you're carrying all of the, or you're having to make assumptions, I should say.
I think that's spot on. I think sometimes I'll find myself in the room having the conversation led by a supportive care partner who would have a very specific way of approach to their care, but that's not necessarily what the patient living with MS would prefer. And I think having those conversations in prep can be helpful to ensure that you're doing your best as a care partner to advocate for the patient rather than approach care the way you would want to be treated for yourself.
Got it. Perfect. Another question in here was about what to do when an MS specialist says they no longer need to see you as they've done all they can do, and they either tell you to go back to your primary neurologist for care or sometimes primary care physician for continuing care. Any advice or feedback on that situation?
This is tough. You know, you all may have come up in different eras of MS, but certainly as someone who's been in this world for the short time I have, I've learned a lot of the history of MS, which is that there was an approach once upon a time, not too long ago, that there may not be a whole lot to offer. So there's that historical bias. And then more recently, with the incredible explosion of our therapeutic options as well as our therapeutic approaches, it's sort of swung the other way. And I frequently find my general neurology colleagues saying, oh, I don't think I can care for patients with MS. It's too much to know. And so there, you could get caught on either end of that and still feel like you're not getting the care that you deserve. And in order to best advocate for yourself, I think it's okay to say, not really moving forward, what are your plans there? And as we've referred to previously, kind of looking at other resources to say, what are the other options, and directly having those questions asked and answered in the visit. What do you think, Lucy?
I think you summed that up really well. Sometimes I think patients have, you have a preference as to where you want that care. Maybe it is with a general neurologist, somebody that you've had a relationship with, or maybe it is that specialist you were waiting months to get in to see, and that's who you want to establish that care with. And so, as you said, I think it's finding that match that can be a really important piece to this too.
Great. Another one that I have in here is what to do when your neurologist says to you, we can do it if you want, when requesting like advice or, trying to make a decision on whether an MRI is needed based on symptoms, but they are kind of taking more of a backseat and just saying they can do it if the patient wants it. Like, what do you do in that situation if they're more passive?
What do you think, Suma?
I'm thinking about this. I've run into this a few times with, honestly, the trainees that I'm teaching of how to best approach care for MS, and it's so uh, it's so individual. And I think for you, the patient who asked this question, the person who asked this question, I think it's okay to say, what would you recommend? You know, ask more outright, especially if there seems to be both ways. And then sometimes we acknowledge that, again, there's no one right answer, right? And so sometimes we do things like obtain imaging to ensure that we are very confident, even though the likelihood of needing it might be low. And so acknowledging the limitations of the decisions we make, because many of the decisions we make are not 100%. But if you feel like there's more passivity there and you would prefer for the healthcare provider to help guide that decision with a little bit more voice, I think it's okay to ask for that.
And then it kind of in the same hand of talking about neurologists, is there a time when you wouldn't need to see a neurologist anymore, where you can kind of decide that that's not really who you need to continue seeing if you've reached a certain point?
Yeah, this is a tough one too. You know, I tend to be a little bit more all hands on deck, and I think it may be just by virtue of being in this field for as long as I have. But it depends on you. If you know your body best, if you're living with MS, particularly when it comes to your relationship with MS and how long you may have known your healthcare provider. And so if you know that things have been stable for decades and the visits or the travel or the time spent preparing isn't. And I think it's okay to again have that conversation to say, you know, I've been coming here annually or twice a year, and I really don't feel like we're making any active changes. Is it okay if we go to as needed? And that helps you still stay at touch, at reach, but without necessarily committing to that follow-up appointment plan.
Gotcha. I have one that I think would be great for Lucy to answer. Somebody said, I feel like depression holds me back from developing a support team. What do you recommend to start?
Yeah, that's a hard one too. When you feel like your team isn't maybe adequate or maybe doesn't perhaps have the skill to be kind of available and meet kind of what those needs are. So I would say, take a look at those around you within your own, family and friend network. Do you have those that you think could be trusted, that could step into that role with, some guidance or maybe some support along the way of kind of understanding your journey? If not, that may be the case too. Can you look elsewhere? MS support groups, whether they're provided through the National MS Society or local chapter, or maybe forums such as what we offer here through Can Do with some of our coaching series. Could that provide some of that avenue for support where you feel like you're with a group of people who kind of just get it, who can give you some of that advice to help you feel more empowered for those visits?
Wonderful. And then we have time for a couple more. I have one in here that is basically just saying, are doctors upset if you get a second opinion, if you disagree?
I don't think so. At least certainly I can speak for myself. I think that's the reason why we're all here today, right? To discuss shared decision making. And I think receiving a second opinion is, in my eyes, your way of ensuring that you have all the information you need to help make educated decisions.
Perfect. And I think that's pretty much all of our questions for now, so we can make sure we have enough time to do our wrap up. So I will go ahead in advance. This webinar may be over, but I wanted to encourage everybody to connect with us via social media. We also send out reminders about all the different programs if you want little reminders in your feed about when we're doing a jumpstart or when we're doing a YQA program. And make sure if you have all of your questions that you're still thought of throughout the program, you can also bring them to those other programs to address them that are later this month. And then you can also sign up for a monthly e-newsletter that at cando-ms.org to make sure that you get all of that sent to your inbox as well. And I would just like to thank our speakers one more time for coming and joining us tonight. It was really awesome having both of you here, and I really appreciate everything that you guys have put into the program. You know, for all the participants out there, we would love for you to fill out the survey that'll pop up at the end of this webinar. It'll also get sent out to you. And just a reminder, this webinar is recorded, so the recording will be sent out to you if you'd like to review anything that we chatted about tonight. So thank you everybody for joining, and have a great night.